Boris Johnson is expected to lift the government's blanket work-from-home policy later today.
Well, it comes just 24 hours after the UK's chief scientific officer warned there is absolutely no reason to change the current guidance. So, are people ready to return to work?
I think it's too soon, but if they can manage to stay at home and work from there, I think it's easier, it's better.
Like if the shops can open and we can all flood into a shop, then why can't people sit at the desks?
If they can keep staying at home, it would be better for the whole country, for people to stay at home, for pollution.
I feel safe on it. I've got my mask and we've got the lotion for our hands, so yeah, definitely.
Well, to discuss this, we're joined by Professor of Health Psychology, Susan Reid, who thinks it's up to employees to make workers feel safe. Apprentice star Claude Littner, who believes it's paramount for people to get back to the office. And aerospace policy advisor Ollie Newton, who has type 1 diabetes, who says that he's worried about returning to work. Good morning to you all. Thanks for joining us. Ollie, let's start with you then, because, you know, for you, have you been working from home and then you're now having to face going back to the office, but you're worried about the consequences of that?
Yeah, so like you said, I live with type 1 diabetes, so it puts me in a more vulnerable position if I do contract the infection. I've been really lucky in that my employer has been really flexible about working from home. They've been really good at making sure that we're able to get our sort of second screens, office chairs, keyboards, things like that. For me, returning to the office is not something that I want to be doing at this stage, particularly while there's still a lot of infection around. Travelling on public transport at the moment is something that I'm avoiding at all costs. Been just as productive working from home. So for me at the moment, I'm definitely keen to keep working in the current way.
Do you think it's difficult because there will be those people who will feel obliged to go back in, or their companies might say, we expect you to be back in the office? It must be a difficult situation if people are having to go back and then worried about the consequences, about what might happen. Absolutely.
I mean, I do worry that if employers take that route about forcing people to go back into the office. I mean, like I said, I've been really lucky so far. My employer has been really flexible about it and really sensible. And I think that that's something that all employers should be looking to do, making sure that their staff feel that they are able to make their own decision about returning to the office. I think that's really important, particularly for those that may be in a more vulnerable position or live with people that may be more vulnerable if they were to catch the disease.
Yeah, and coming to you, Professor Mickey, I apologise, I called you Mikey before, didn't I? What's your take on this? Because, for a lot of people, they've had to make huge adjustments, haven't they, to work from home, tuck themselves away, cope with the mental stresses and strains of having to do that. And now it's another huge adjustment to be expected to go back in, to then be exposed to more risk and have to try and manage that.
Well, I think you're right. Any more contact with people you don't know, with lots of people, where you're spending many hours with people, sometimes in close proximity, will increase the risk. And I completely agree with your previous speaker that people should be left to judge for themselves, so long as they're productive at work, which many people are, and many people are more productive at work because you're not spending hours a day commuting. Then give them the control. Can they stay at home, or can they come into work? For those people who have to go into work or want to go into work, there are various things that can be done to really help them. I think there's a group of people who are emotionally quite anxious and fearful, who've been restricting their activities in general. And for them, I think this idea of a graded return to work, maybe just one day a week to begin with, see how it goes, and then build on that. And also possibly thinking of a buddy system where they can go into work with someone else. They're not completely on their own. Then there's a group of people who are really weighing up the pros and cons in terms of risks. And for them, I think what's really important is for the employer to explain, actually the employer should explain to all their staff what the risks are in an honest, open way, what measures have been taken to mitigate those risks, such as perspex screens or one-way walkways, and so that people can be reassured that they're not going to be put at risk.
Yeah.
And the final thing I'd say is that really important for people to manage their anxiety, to give them control, so that they know if they do come into work, they find a situation that does seem to be unhealthy or risky in any way, that there's a confidential phone number that they can phone to explain what the problem is. And also, bottom line, they do have a legal right to leave the workplace if they don't think it's safe.
OK. Professor, thank you. And Claude Littner, we'll come to you in a second. Joining us now is Andy Burnham, a British Labour politician who served as Mayor of Greater Manchester since 2017. Andy, thanks for joining us. I mean,
you're welcome.
We're just hearing there from the Professor that some of the problems here is the onus is really going to be on employers to create a safe environment, to have a system in place. We're trusting employers to do that. For some of them, it's very difficult. We spoke to some employers yesterday who, just financially, it's not always easy to supply all the right PPE and all that kind of protection. I mean, how are you going to make sure in your area, in Manchester, that employers are going to be accountable and that the workers are going to have a level of protection?
Well, firstly, I'd say I agree with all the points Susan was just making about giving people the right to walk out. Because we actually had this problem when lockdown started. Many people were required to stay in work, and I actually asked people to complain to me if they felt they weren't safe at work, and we referred those complaints to Trading Standards and Greater Manchester Police, who looked into them. So there have been issues, even through lockdown, with people feeling unsafe at work, and I just think we can't have that. We've got to have a safety-led return to work. And if there's any doubt at all, people should be supported not to work in a place where they feel insecure.
Where are you sitting on this? Because there is already a bit of confusion from the government. Boris Johnson is going to announce the big plan to get everyone back to work. But Patrick Vallance, at the inquiry chat yesterday, the committee chat yesterday, said that actually he felt that probably still the safest and most sensible thing is to probably stay at home. So we're getting confusing messages. If you could choose one or the other, which one would it be?
Well, I'm not against what the Prime Minister is saying, but there's conditions going to be attached here, because he's asking people to go back to work, but his government are still not doing everything they can do to support local councils to manage the risks. So they're not giving us all of the data about cases in our local areas, and particularly named patient data, so that we can get quickly to the source of outbreaks. And that feels to me to be crucial before the Prime Minister encourages any turn to work. And the contact tracing system isn't working properly either. And I think he's got to get those things right before he says, right, everybody back to work. And just a further point, it can't be a full return to work either. I'm looking at my own organisation in city centre Manchester. We're working on the basis that a maximum of a third of our workforce will come back to the office when this guidance changes. And let's remember, that's for people who are struggling to work at home, because I think there are some people who really do need to be able to come out of the home environment and get back to the office. So I would give him cautious support with all of those conditions.
Claude Littner, coming to you now. I mean, you strongly believe that it's important for people to get back to the office. It will be good for the economy for them to do so. We were hearing earlier from Professor Mickey, who was saying about, the importance for employers to show their employees that they've taken the necessary measures, that there's a whistleblowing system if necessary, that employees feel that they can say to companies, actually, I'm not happy about this. So do you think from that point of view, companies need to work extra hard at the moment to make sure that workers feel safe to go back into the office environment?
OK, well, good morning. I happen to agree with everything that your other contributors have said, because it's not a gung-ho, everyone back to work, things have returned to normality. Things are not safe, and everyone wants to feel safe. So for those who have got particular medical problems, I completely understand their desire, willingness to carry on working from home. That's absolutely correct. And of course, the employer has got a legal duty of care towards his employees. So he has to make things as safe as possible for returning employees.